What is adenomyosis? Now, adenomyosis is nothing but it is just the endometriosis. Okay, so it is presence of endometrial tissue within the uterine wall, that is the myometrium. Now, I've already told you that endometriosis, we talked about endometriosis. What did I tell you about endometriosis? I told you that endometriosis means presence of endometrial tissue in some ectopic sites, right? So these ectopic sites can be the ovary, right? Ovary, it can be the intestine, it can be pouch of Douglas, it can be cul-de-sac, it can be broad ligament. But the endometrial tissue, this endometrial tissue, it is present within the myometrium, right? That means it is present in the myometrium. If the endometrial tissue is present inside the myometrium, that is known as adenomyosis. So remember here, I'm going to show you a drawing. So see here, endometriosis versus adenomyosis. What is the difference? So see, endometriosis means endometriosis means presence of endometrial tissue in the ovary, here outside. Okay, so it is this is known as endometriosis. However, adenomyosis, what does adenomyosis mean? Adenomyosis is the presence of endometrial tissue in the myometrium. So this is the muscle, right? This is the muscle of the uterus, you can see. So if the endometrial gland is present in the muscle of the uterus, as you can see, if it is present in the myometrium, this is known as adenomyosis. So myo stands for the myometrium of the uterus if the endometrial gland is present, right? So that is known as the adenomyosis. So adenomyosis is the presence of endometrial tissue within the uterine wall or the myometrium. Now, what is the remember one thing in adenomyosis. Adenomyosis, I'll write the definition here. Okay, so look here. So what is adenomyosis? Adenomyosis is the presence of endometrial glands or stroma if it is present in the myometrium. Now, where in the myometrium? What is the requirement? For example, if this is the uterine wall, so if this is the uterine wall, right? So you know that this is the endometrium and this is the myometrium, and this is the endometrial myometrium junction. This is the junction. So we can say that we can define adenomyosis if the endometrial tissue is present at least 2.5 millimeter, 2.5 millimeter from the junction. So if this is the junction, right? If this is the junction, then deep, okay, 2.5 mm deep. If the endometrial tissue is present 2.5 mm deep from the endometrium myometrium junction, then we can call it adenomyosis. So remember this condition, at least 2.5 mm deep from endometrial myometrium junction. Now gross and microscopy will understand it by looking at the drawing. Now as you can see, this is the cervix, right? This is the cervix, this is the cervix. Now as these are the endometrial tissue, okay, so these are the endometrial tissue. These endometrial tissue are present within the myometrium, right? This is the endometrial cavity. So this is present in the muscle of the uterus. So if this is present in the muscle of the uterus, you can see that uterus is very enlarged. So one of the very important gross feature, as you can see by your own eyes, okay, is that there is the presence of enlarged uterus. There is the presence of enlarged uterus, right? So there is this uterus in enlargement, it is generally asymmetric. So you can see here it is a big, here it is a big small, right? So you can say that it is asymmetric uterine enlargement. So there are different foci. These are all the foci of endometrium. So these are small dot like petechiae. So you can say it is a petechiae like foci of endometrium is present. These all are blood filled, right? So this is generally the gross feature of adenomyosis. So let me see what is written here. So here it is written slightly or markedly enlarged uterus. So there are focal areas of hemorrhage. So blood vessels, these are functional. So they are going to bleed here also. So as they are going to bleed here also, so you can say that there is areas of hemorrhage. So you can write that areas of hemorrhage as well in the gross features. Now if you talk about microscopy, so if you look at the microscopy, this is the microscopy. Generally, this is the muscular layer. So these two are the muscular layers. These are the myometrium. So this is the muscular layers, myometrium, that is the muscle layer. So in between the muscle layer, there is the presence of endometrium. So this is the endometrium. So in the endometrium, there is the presence of stroma, and these are the glands. So it is just same similar. Okay, so just similar, you can just write, presence of stroma. So this is the glands, presence of glands and presence of stroma. So this is basically the microscopy. So let me look here. So it is just the same. So in microscopy, we are going to see endometrial tissue. Endometrial tissue means endometrial stroma and glands. These are arranged in the myometrium, and these are separated from the basal layer by at least 2 to 3 millimeter. I have already told you these are separated. Okay, these are present at least 2.5 millimeter from the basal layer or the junction layer. Muscle hypertrophy is seen. So this is all about adenomyosis and endometriosis. I hope you understood it. Thank you.